Hi everyone, how you doing? Today let's look at some of the best cosmetic dental treatments that you can get up to around £6,000. Now these treatments are going to let you get an amazing beaming smile, almost as good as those Peloton bike instructors. And if like me, you've just spent a whole load of money on a Peloton exercise bike, these are some of the more cost-effective treatments. Now bear in mind, everybody prices things slightly differently. The figures we're going to talk about today are kind of ballpark, rough guesses on how much these treatments are going to cost near where you live. And remember, the price is also going to vary on the experience of the clinician and the dental practice. Okay, let's start with our most basic cosmetic dental treatment, which is teeth whitening, and we're going to bundle this in with a dental hygiene session as well with stain removal. Now bear in mind guys, I'm going to talk to you about the advantages of all of these dental treatments and what they can do for you, but I'll also be honest about the disadvantages and the side effects and things to consider if you're going down this route. But with a hygiene session, I'd honestly say there's very little disadvantage to having a hygiene session. I would say it's actually more important to see your dental hygienist than it is to see a dentist for regular checkups. Your dental hygienist can not only clean your teeth, which will make your gums a lot more healthy. If you're concerned about gum disease, I've got another video all about that. But having nice healthy gums actually improves the look of your teeth, okay? Unhealthy gums are red, they're inflamed, they're not very well defined. Healthy gums look pink, they're sharply defined, they've got these pink papillae in between the teeth, these pink triangles which I obsess about. And if you have a stain removal treatment, then you can have really shiny, smooth, clean teeth as well. Now a lot of dental hygienists are also dental therapists, so it's worth checking this out before you go and see your dental therapist, because a dental therapist can do basic level checkups, they can take x-rays, they can do fillings, and they can do a lot more than just a general hygienist. So there is a big difference, and it's probably worth figuring out your local hygienist. Are they a therapist as well? Now once you've got all your tea, coffee staining off your teeth and your teeth are a little bit whiter, they feel good, this is an excellent time to consider teeth whitening. So teeth whitening, there's a number of ways of doing it, but for the last 10 years we've only done what we call home whitening, and this is where you get a whitening tray made which fits over your teeth, and then you fill this tray up with the whitening solution and you wear it for a period of time. Now there's different types of solutions, so this means that the wear time is going to be different for a lot of people. The end results are pretty similar no matter how you kind of go about it, but the reason for the different concentrations is all to do with the side effect of whitening, which is sensitivity. So sensitivity is going to affect people very differently. When I first did teeth whitening, I got a little bit of sensitivity. It was okay. I would be just driving along randomly, a tooth would go bing, all right, and it's kind of disconcerting if you're not expecting it. But as I've done teeth whitening a few times, the sensitivity has increased a little bit. It's not absolutely crazy, but for some of our patients who we see, the amount of sensitivity that they get is pretty significant. Now, another advantage of seeing a hygienist before you have this done is they can look at the amount of tooth recession that you've got, and tooth recession is a good marker on the amount of sensitivity you're going to get. Now, of course, there are treatments, anti-sensitivity treatments, anti-sensitivity toothpastes that you can get, which will help calm down this side effect. And using a lesser concentrated gel will also help you, but it means that results might be a little bit longer to kind of get to. Usually teeth whitening is about 2 weeks. It might take you 4 to 6 weeks if you have particularly sensitive teeth. Now a lot of people come to us and they just have normal teeth whitening, but teeth whitening can also be used as a treatment to kind of enhance another treatment. So for example, if someone's having veneers and they only want to have 2 veneers at the top, sometimes we'll just whiten the lower teeth and we can change the shape with our next treatment, which is called composite bonding. So composite bonding is really fashionable these days. It seems to be, so many dentists are providing it. It's a quick and easy treatment. Essentially, we're just taking composite, which is a filling material. Okay, so if you've ever had a white filling material, it's composite. It's exactly the same materials used to enhance the shape of the front teeth. Now, the cost of composite bonding is going to vary a lot depending on the number of teeth you need to have done or the amount of tooth coverage coverage that we need to do. Okay, so we're going to start with just talking about edge bonding, which is just reshaping the edges of the teeth. Now, sometimes our patients will come in and they've got very uneven tooth wear, or maybe we've had a course of brace treatment and that's straightened the teeth out, but because they were kind of crowded, they've worn in a funny pattern. It looked fine back then, but now everything's straight, the wear is very uneven. So in these situations, something like composite bonding works really, really well, because you can just re-tip the edge of the teeth, and the edge of the teeth is a really critical area in terms of aesthetics. The back of your mouth is dark, the teeth are white, and we've got this really high contrast area between the white of the tooth and the darkness of the mouth. And whenever you've got a high contrast area like this, that shape of that contrasty line is really, really important in overall aesthetics of the smile. Now, taking composite edge bonding a step further and covering the front of the tooth, you've now got a composite veneer. And personally, I'm kind of on the fence whether this is a great treatment. I personally don't do it because a lot of our patients come and see us for porcelain veneers. Okay, so I'll do another video about that. But we have got team members in the practice who are actually getting really great results with composite veneers. The advantage of this treatment is that it is much less expensive than a porcelain veneer, especially when you start looking at the number of teeth. Another advantage is the amount of time it takes. Usually, composite veneers takes less time than porcelain veneers. However, the slight downside is that composite isn't as hard a material as porcelain. This means that it's going to age differently, and abrasives, mild abrasives, which are in toothpaste and just the normal action of brushing your teeth, these can kind of just dull the finish down. Okay, on the day that you have the composite veneers, it will look amazing. They'll be really highly polished. If your dentist has a skillful eye, then the shapes of the teeth will look amazing and you will be completely over the moon with it. But over time, weeks, months, and years, that shine can kind of fade a little bit, okay? And most people don't actually really notice it, but if you're paying particular attention to the appearance of your smile, then you might notice that they're less shiny, and this is because they've picked up kind of micro scratches over the time. Now, you can have your teeth rebuffed, so there's a little bit more maintenance involved with composite veneers. If the treatment's done badly, not only does the composite not look amazing, but the edges can pick up staining over time as well. And we do get people who come to us for porcelain veneers because they feel that it's time to upgrade from their composite to porcelain veneers. But these composite veneers have lasted many, many years. And I think with today's composites and today's techniques, this is a good treatment solution. It's just not something that I personally provide because of the composites which were done 10, 15 years ago, which I'm seeing and we're changing to porcelain. But in these videos, I just want to be completely and honest about my experiences. Okay, it is a great treatment in the right hands. And as I say, we've got associates in the practice who are actually really good at this treatment. The next treatment I think we should talk about is braces. Okay, and there's loads of different types of braces, but in essence, they all do exactly the same thing. They will take a smile where the teeth are maybe not perfectly straight and aligned, and over time, we'll be able to straighten those teeth. Now, it used to be that braces was the realms of specialists, and a dental specialist who does only braces is called an orthodontist, and the treatment was kind of skewed much more towards children because it used to be that many more children were able to get orthodontic treatment in the UK for free, okay, because it was covered under the NHS. Now, as shrinkflation happens, then the kind of severity of treatment that is available under the NHS increases, so less and less people are eligible for this treatment. However, there has been a massive explosion over the last 10 years with adults having brace treatment. Okay, companies like Invisalign have come along, and there was 6 Month Smile. I'm not sure if they're still around, but essentially they made this brace treatment, which used to be an Ugly Betty kind of brace. They either made it popular by having ceramic braces. By the way, these ceramic braces have been around forever as well, or Invisalign came around and they've developed what's called aligner treatment, which looks very similar to a teeth whitening tray, and they've made the treatment look much more socially acceptable. something like Invisalign, for example, it's very difficult to see that somebody's got Invisalign. I mean, some of my friends, school dads, they're getting Invisalign treatment, not with us, but I can pick it up straight away, but that's my job, right? I'm always looking at this area. When you put the aligners in, yeah, you're going to feel a little bit self-conscious initially, but to be honest, it's such a common thing, and once you have it, you'll notice that so many other people are getting their teeth straightened with this kind of treatment. Now, there's advantages and disadvantages to a fixed brace, kind of like this or this, versus an aligner brace like Invisalign, but it doesn't have to be Invisalign. There are so many companies doing it. It's just that Invisalign seems to be the biggest brand. And again, with the right clinician helping you, you will be able to achieve really, really great results. So what are the disadvantages of braces? Well, they do hurt. Okay, that first week is pretty uncomfortable. You're going to need a couple of painkillers. A lot of people put braces down as a kind of a minimally invasive treatment, and it kind of is, because you get to keep the majority of your natural teeth. But if you look at an arch like this, you can see that there's not enough space to straighten everything out. So often we need to create spaces by drilling really fine gaps between the teeth. Okay, it's done without anesthetic. It's nothing major, but it is something just to be aware of. And in some situations, there's just not enough space to have all the teeth aligned. So maybe we'll consider removing a couple of teeth on the side to create the space, and then all your teeth can be perfectly aligned, closing all the spaces as your treatment progresses. These treatments often take a long time. If we're looking at extraction treatment where we're taking teeth out, quite often 18 months, 2 years is a typical kind of time horizon for this. But for the vast majority of people who are just looking for a cosmetic fix and their situation isn't that bad, then often around 6 months to a year is kind of typical. Now, with this kind of treatment, we do often supplement it with the composite edge bonding and the teeth whitening. In fact, in dental world, this seems to be called ABB, align, bleach and bond. Because if you combine these treatments, for a lot of people, it is a life-changing, it's almost like a smile design treatment done with porcelain veneers. And I'm pretty confident that all those people I'm seeing on my Peloton bike, all they've had is braces and teeth whitening. Now, there is another type of brace, and this brace is fitted to the inside of the teeth. Now, this kind of brace is really specialist, and not a lot of people will provide it, and the cost is almost double that of the other types of braces. So it kind of falls outside what's achievable within the £6,000 mark. Now, the last treatment I'm going to talk about is porcelain veneers. Now, porcelain veneers are expensive, okay? And the cost of these can dramatically be way above the kind of £6,000 figure that I've pulled out of thin air to talk about today. And different places will charge differently for porcelain veneers. But let's say a porcelain veneer will cost roughly £1,200. So you can get maybe 4 veneers done or 4 front teeth done, and this is kind of like a mini makeover. It works for some people, and the advantage is obviously the cost. We're doing less treatment to achieve that overall look. But there's always going to be a slight difference between the veneers and the natural teeth. Now, this is a case we fitted literally the other day, and there is a deliberate difference. We had a conversation with the patient. He wanted his teeth to be whiter than the canine teeth anyway, knowing that there'll be a visible difference. But with anything porcelain, it is handmade, so it can be made to match the smile perfectly. So this treatment might be good if you've suffered trauma like this lady, and we just did the front 2 teeth, I think, and we can blend everything in with the existing shape of all of the other teeth, making it almost invisible that she got hit outside a club. So if you found this video useful, please do give it a thumbs up. It makes it more visible to other people who might be looking for these kind of treatments. In our next video, we're going to be talking about the more complex treatments. Okay, these are treatments going from like 6, 7, 8,000, 20,000, 30,000 pound treatments. These are much more complicated treatments for people who are in a much more complicated situation. They've worked really hard all their life. They've got the money to pay for it. What are the kind of options that we've got available to achieve a perfect smile, and what's the difference between the really expensive stuff and the stuff that we've talked about in this video? Okay, so stay tuned for that video. I'll see you soon. Take care.